Hi, it's Dr. William, and I'm here with a patient who's now 9 months out from having liposuction, lipo360, and a breast lift with an implant. She's really, honestly, a model patient. She could be a model, but she's like a model patient because she has literally followed every single part of the protocol. And I just say to people, all you have to do is get on the bus and follow the protocol. It's going to take you right to your destination. So she's actually wearing our new, we haven't released this yet, but this is an OG recovery post-operative bra. This is a prototype that she's wearing. But I'm just going to take your bra. I want you to look at her scars at 9 months. This is just regular scarring after a breast lift with an implant. So her scar is around the areola. So you'll see the white line between the darker areola tissue and her own skin. You'll see that white, but it's thin and it's flat. And then this is the scar that everyone always worries about, but now we're 9 months out. She's been using the scar gel and she's been wearing the strips at night very diligently. The thing about scar care is you have to do it very consistently, and it takes about a year for you to get your final result, or even longer really. But here she is at 9 months. And so this is the scar that most people worry about. She also has a scar underneath here, but we can't see it. In terms of healing, this scar is non-visible. This scar here typically heals pretty well, although there is quite often it's hypopigmented like this. But this scar actually heals the best. And really the reason that this one heals the best is the scar kind of gets broken up a little bit, because as the implant settles, there's some movement on that scar to kind of help sort of blend it into the rest of the tissue. So it's still a little bit red, which is normal at 9 months because there's still a lot of activity with scar remodeling going on. And that's why it's red, because you have more red blood cells there, but there's more inflammation, there's more work. This is an active, like, construction site. If you were to drive by on a street and see this construction site, the building would be probably like 70% built, but you still see a lot of people walking around and lumber and cranes and all that stuff. There's a lot of activity going on here, same thing. That's why it's still a little bit red. That redness will fade, but once that redness fades, you can even see here it's starting to get difficult to see. But once this redness fades, that will all be difficult. And she will always have a scar here. It's impossible not to have a scar, but she will have a scar that's very difficult to perceive. And that's really what we try to do with scar care, is to give you a scar that, yes, it's still going to be there, but it is the best possible scar that your genes will allow you to have. But it takes a lot of work. So I'm personally grateful that she's put in the work, because ultimately I would like her not to have a visible scar. And now at 9 months, if she continues to do this for another 3 months, she's going to be golden. And in 2 years, it's going to be very difficult to see these scars. So that's what it takes to get a good scar. 2 minutes twice a day for the scar gel massage. You have to roll in a circle, you have to roll in a line, and then you wear the silicone scar strips at night, and then you can get a really good result. And the thing is, people tend to give up on it because it's, it's a nuisance to have to do something twice a day and then every night and do that consistently 7 days a week. But I'm thankful that patients do and put in the effort, because the rewards are great.